For many men, changes in sexual performance don't happen all at once. They tend to creep in quietly. At first, it might be occasional difficulty maintaining an erection on a stressful day, or a moment where things don't respond the way they used to. It's easy to dismiss. Maybe it's fatigue, maybe it's distraction, maybe it's just a bad day. But over time, when these moments become more frequent, they begin to carry emotional weight. Confidence shifts, anxiety starts to appear where ease once existed, and often men don't talk about it. In clinical practice, this is something I see regularly. Men come in not just with a physical concern, but with a sense of frustration, confusion, and sometimes even embarrassment. They wonder if something is wrong with them. They question whether it's aging, stress, or something deeper. What's important to understand is that erectile function is not just about one organ or one moment. It reflects the health of the entire body, blood vessels, nerves, hormones, and even emotional well-being all working together. That's why conversations around erectile dysfunction or ED are shifting. Instead of viewing it as a standalone issue, we now understand it as a signal. It can be an early indicator of changes happening in the body, particularly related to blood flow. The same blood vessels that support erections are also involved in heart health, brain function, and overall circulation. When those vessels aren't working optimally, the effects may show up first in sexual function. Because of this, many people are surprised to learn how much lifestyle plays a role. What you eat, how active you are, how well you sleep, and whether you smoke or manage chronic conditions, all of these factors contribute to how well your body performs in intimate moments. Yet, for years, the focus has often been on quick fixes rather than foundational health. This is where things become particularly interesting. Imagine a patient sitting across from me asking a very common question: is there anything natural I can do? They're not necessarily looking for a miracle cure, but they want to feel some sense of control. They want to know that small, everyday choices might make a difference. And increasingly, research is beginning to support that idea. We're learning that certain nutrients and compounds found in everyday foods may have a meaningful relationship with vascular health, the health of your blood vessels. When blood vessels function well, they expand and contract efficiently, allowing blood to flow where it's needed. In the context of sexual health, that flow is essential. Without it, even if desire is present, the physical response may not follow. This connection between diet and erectile function is not entirely new, but the details are becoming clearer. Large-scale population studies are starting to show patterns, subtle but important links between what people consume and how their bodies respond over time. These are not dramatic overnight transformations. Instead, they represent gradual influences that, when combined with other healthy habits, can shift outcomes in a positive direction. One of the reasons this matters so much is because it reframes the conversation. Instead of focusing solely on treatment after a problem develops, it opens the door to prevention and support. It suggests that what you put on your plate each day may quietly influence your long-term sexual health. Of course, it's important to approach this with balance. No single food or ingredient can override all other factors. If someone is dealing with significant medical conditions like diabetes, high blood pressure, or cardiovascular disease, those need to be addressed directly. But alongside medical care, nutrition becomes a powerful ally rather than an afterthought. Another layer to this conversation is cultural familiarity. Many of the foods that contain beneficial compounds are already part of traditional diets around the world. People often don't realize that what they've been eating for years, family recipes, regional dishes, everyday ingredients, may carry hidden health advantages. This makes the idea of improving diet feel less like a restriction and more like a rediscovery. At the same time, there's a need for clarity. In the age of social media and quick health claims, it's easy for information to become exaggerated or misunderstood. A single study can be interpreted as a guaranteed solution, when in reality, science is more nuanced. Associations do not always mean direct cause and effect. What they do offer, however, is direction, clues that guide us toward better understanding. So when we talk about a specific nutrient being linked to improved erectile function, it's not about hype. It's about examining the evidence carefully and asking, what might this mean for real people in real life? Could incorporating certain foods support better circulation? Could it complement other healthy habits? Could it offer a simple, accessible way to improve overall well-being? These are the kinds of questions that matter. As we move forward, we'll explore one particular compound that has been gaining attention in this space. It's not rare or exotic. In fact, it's found in foods many people already enjoy. What makes it fascinating is how it interacts with the body at a cellular level and how that interaction might translate into something as complex and personal as sexual function. Understanding this connection doesn't just provide information, it provides perspective. It reminds us that it is deeply interconnected and that even small, consistent choices can have meaningful effects over time. To understand why certain foods may influence erectile function, it helps to step back and look at how erections actually occur. At its core, an erection is a vascular event, meaning it depends heavily on blood flow. When a man becomes aroused, signals from the brain travel through nerves to the blood vessels in the penis, causing them to relax and widen. This allows blood to rush in and fill specialized chambers, creating firmness. If anything interferes with that process, whether it's reduced blood flow, nerve dysfunction, or hormonal imbalance, the result can be difficulty achieving or maintaining an erection. This is where the concept of oxidative stress comes into play. Over time, factors like poor diet, smoking, chronic illness, and even aging can lead to the buildup of unstable molecules called free radicals. These molecules can damage the inner lining of blood vessels, making them less flexible and less responsive. When blood vessels lose that flexibility, they cannot expand as effectively, which directly impacts circulation. In the context of sexual health, that means less efficient blood flow exactly where it's needed most. Now, this is where certain nutrients begin to matter in a meaningful way. Among them is a naturally occurring compound called lycopene. Lycopene belongs to a group of pigments known as carotenoids, which give certain fruits and vegetables their vibrant red or pink color. You'll find it in foods like tomatoes, watermelon, pink grapefruit, and papaya, items that are often already part of everyday diets in many cultures. What makes lycopene particularly interesting is its role as an antioxidant. In simple terms, antioxidants help neutralize free radicals, reducing the damage they can cause to cells and tissues. By protecting the lining of blood vessels, lycopene may help preserve their ability to relax and expand. This effect is subtle, but over time, it can support better circulation throughout the body, including in areas critical for sexual function. A large population-based study conducted using national health data explored this connection more closely. Researchers examined thousands of men and compared their dietary intake of lycopene with reports of erectile function. When participants were grouped based on how much lycopene they consumed, a clear pattern began to emerge. Men who consumed higher amounts of lycopene-rich foods were less likely to report erectile difficulties compared to those with lower intake. What's particularly noteworthy is that this relationship remained even after accounting for other important factors such as age, weight, smoking status, and underlying health conditions. In other words, the association wasn't simply explained by healthier individuals eating better overall. There appeared to be an independent link worth paying attention to. To strengthen their findings, researchers used a statistical approach designed to balance differences between groups, making comparisons more reliable. Even after this adjustment, the pattern held steady. Lower intake of lycopene continued to be associated with a higher likelihood of erectile issues. While this does not prove cause and effect, it does suggest that diet may play a supportive role in maintaining sexual health. Interestingly, the benefits were not uniform across all groups. The association appeared stronger in certain populations, including men with lower body weight, those with high blood pressure, and individuals who did not smoke. This makes sense when you consider how different health conditions interact. For example, smoking and diabetes are both known to significantly impair blood vessel function. In those cases, the protective effects of dietary antioxidants may be less noticeable because the underlying damage is more severe. Another important aspect of this research is the concept of dose. The data suggests that there may be a range where lycopene intake provides the most benefit. Moderate daily amounts, often achieved through regular consumption of common foods, appear to be sufficient. Beyond that, the benefits may level off rather than continue increasing dramatically. This reinforces the idea that consistency matters more than excess. From a practical standpoint, this is encouraging. It means that incorporating lycopene into your diet does not require drastic changes or expensive supplements. Simple choices like including tomato-based dishes, enjoying fresh fruit, or adding variety to meals can naturally provide these compounds. Interestingly, cooking certain foods, especially tomatoes, can actually enhance the body's ability to absorb lycopene. Heat breaks down the plant structure, making the nutrient more available during digestion. Beyond erectile function, lycopene has also been studied in relation to prostate health. Some evidence suggests it may help support men dealing with an enlarged prostate and could potentially influence markers used in prostate cancer screening. However, these findings are not entirely consistent, and more research is needed before drawing firm conclusions. What remains clear is that its antioxidant properties contribute to overall cellular health. It's important to pause here and address a common misconception. When people hear about a nutrient linked to improved health outcomes, there's often a tendency to view it as a solution on its own. In reality, erectile function is influenced by a combination of factors. Diet is one piece of a much larger puzzle that includes physical activity, sleep quality, stress management, and the presence or absence of chronic disease. Think of lycopene not as a cure, but as part of a supportive environment. When combined with other healthy habits, it may help optimize the conditions your body needs to function at its best. But if major contributing factors like uncontrolled diabetes or smoking remain unaddressed, no single dietary change will fully compensate for that. This balanced perspective is essential. It allows us to appreciate the role of nutrition without overstating its impact. It also empowers individuals to make informed, realistic changes rather than chasing quick fixes. As we transition into the final part of this discussion, the focus shifts from understanding to application. The question becomes not just what the science says, but how to translate that knowledge into daily life in a way that feels practical, sustainable, and meaningful. When you step back and look at the bigger picture, what becomes clear is that sexual health is rarely about one isolated factor. It reflects the overall condition of the body, how well the blood vessels function, how balanced the hormones are, how effectively the nervous system communicates, and even how the mind responds to stress and connection. What we eat fits naturally into that system, not as a shortcut or a cure, but as a steady influence that supports or undermines those processes over time. In practical terms, this means that improving erectile function is often less about dramatic interventions and more about consistent, sustainable habits. Adding lycopene-rich foods into your diet is one example of this approach. It is simple, accessible, and aligns with broader recommendations for cardiovascular health, including tomato-based dishes, fresh fruits like watermelon, or citrus options such as pink grapefruit can be an easy starting point. For many people, these are not unfamiliar foods. They are already part of everyday meals, just not always consumed with intention. There is also something reassuring about the fact that these changes do not require perfection. You do not need to track exact milligram amounts or follow a rigid plan. Instead, the goal is to create patterns, regularly choosing whole, nutrient-rich foods over highly processed options, incorporating color and variety into meals, and being mindful of balance rather than extremes. Over time, these patterns contribute to better vascular health, which in turn supports sexual function. It is also helpful to recognize that how you prepare food can influence its benefits. For example, cooked tomato products may allow the body to absorb lycopene more efficiently than raw forms. This means that familiar dishes, soups, sauces, or traditional recipes can be both comforting and beneficial. In many cultures, these ingredients are already staples, which highlights an important point. Sometimes the foundation for better health is already present in the foods people know and enjoy. At the same time, nutrition should not be viewed in isolation. If someone is experiencing erectile difficulties, it is important to consider the full context. Conditions like high blood pressure, diabetes, and high cholesterol directly affect blood vessel health. Addressing these conditions through medical care, lifestyle adjustments, and regular monitoring is essential. Similarly, smoking has a well-documented negative impact on circulation, and reducing or eliminating it can significantly improve outcomes. Physical activity is another key component. Regular movement helps maintain healthy blood flow, supports heart function, and improves energy levels. It also has a positive effect on mental health, which plays a larger role in sexual function than many people realize. Anxiety, performance pressure, and chronic stress can all interfere with the body's ability to respond naturally. Creating space for relaxation, rest, and emotional connection is just as important as any physical intervention. In conversations with patients, one of the most common concerns is the desire for certainty. People want to know, if I do this, will it fix the problem? The honest answer is that the body does not always respond in such a predictable way. However, what we do know is that when multiple supportive factors come together, good nutrition, regular activity, controlled medical conditions, and reduced stress, the likelihood of improvement increases. It becomes less about a single solution and more about creating the right environment for the body to function well. Another important aspect is setting realistic expectations. Changes related to diet and lifestyle do not happen overnight. Just as erectile dysfunction often develops gradually, improvement also tends to occur over time. This requires patience and consistency, but it also leads to more sustainable results. Instead of relying on temporary fixes, the focus shifts toward long-term health and resilience. There is also value in reframing how we think about sexual health itself. Rather than viewing it solely through the lens of performance, it can be seen as an extension of overall well-being. When the body feels supported, when the mind is less burdened by stress, and when there is open communication in relationships, sexual experiences tend to improve naturally. This perspective reduces pressure and allows for a more balanced and positive approach. For those who are already experiencing symptoms, seeking guidance is an important step. A healthcare provider can help identify underlying causes, recommend appropriate treatments, and ensure that nothing more serious is being overlooked. Combining medical advice with lifestyle changes often provides the most effective path forward. Ultimately, the takeaway is both simple and powerful. Small, consistent choices matter. The foods you eat, the habits you maintain, and the way you care for your overall health all contribute to how your body functions, including in areas that are deeply personal. Incorporating nutrient-rich foods like those containing lycopene is one piece of that puzzle, an accessible and evidence-informed step that fits naturally into a broader strategy for well-being. When approached with patience and understanding, these changes do more than address a single concern. They support a healthier, more responsive body and a more confident, informed relationship with your own health. And that, more than any quick fix, is what leads to lasting improvement and a better quality of life.